don't know about you, but I love animals. Luckily, I do, because I also have that nonprofit for abused horses and dogs. And I live here in Spain. I live here in nature, surrounded by the rescue animals and also by a lot of, let's say, a little bit wild animals that you can find in nature. Today, I had to bring Jack, the last rescue dog that I have here at the center. I had to bring him to the vet. He needed to be operated. He had a poly, he had a tumor here in his mouth. And that tumor needed to be removed. And I thought to myself, how about I tell you what I do to make sure that my animals are calm, what I do to make sure that I relieve their pain as much as possible, and that they don't have stress or fear and so on. So today, and I'll show you this with pictures and some videos, today I had to bring Jack to the vet. He needed to be there at 12 p.m. my time in Spain here. I stimulated some acupuncture points on his body. And that's something that anybody can do. I stimulated what is called standard points. And I also stimulated the stop bleeding points. And I do that with a little tool here. It's an Advanced Photonic Therapy red light. And this red light can replace the use of needles that you need for an acupressure session, for an acupuncture session. Or you could also use the pressure of your thumb for an acupressure session. But I use this because, first of all, this doesn't hurt. And it has a very specific red light that lets me stimulate acupuncture points. So before we left here, as you can see on the video, I did some standard points on Jack. And following those points, I also did some stop bleeding points. So we went to the clinic. After that, he was calm, he was relaxed. The operation went well. The tumor was removed. With epulis, that's the kind of tumor that it was, it is known that it can come back. And in the case of Jack, it will probably come back because it was really attached to the root of his tooth. And it's this one, it's the big one. We did not want to weaken it. We did not even want to make the opening even larger, because the bigger the opening, the more chance for infections and complications. So yes, I know all that because I was present at the operation. I'm a vet tech and I never leave my animals alone. And my vet knows that. So I was there while it all happened. And at the same time, we took advantage of the fact that he was under anesthesia to also remove growth on his paw. So what happened then? I had my light with me. We laid Jack on the floor on a cushion to recover, to slowly wake up. And I had him, of course, I was with him. And once I saw that he was starting to wake up, and you know, they make those automatic movements with their feet because it's like, I'm trying to get away here, but I'm still not conscious. I started to stimulate his governance vessel 26. So I took it to the torchlight, I put it there, and this opens the capillaries to the brain. And that way, more oxygen can reach the brain. And when you do that, for example, it's a point that you would use on people who are in coma, people who lost consciousness. And by getting more oxygen to the brain, they wake up more easily, they wake up more rapidly. So in Jack's case, I stimulated that point so he would relax when waking up. And the result of that is, apart from also doing his baywee, that's another point on his body, he woke up slowly, calmly. He recognized me immediately. He kept on sleeping a little bit more on my legs. And within the hour, we were able to leave. And yeah, this is what I'm using. for his healing, because the vet then said, oh, in 12 days, you'll remove the stitches from his leg. And I said, you know what? I'll come back in 7 days to show you that we already need to remove them. Because this is another story that happened, many years ago. When was this? This was in 2014. I had saved a little pup from the streets. Probably it had had a hit on the streets, and it had a broken femur. And so I took the pup with me. I had to go and save it, I don't know, about an hour away from my place, or even more, an hour and a half away from my place. But of course, I brought it to my vet, because that's the clinic where I've been going for 20 years. That's the clinic. I know every single one of all the vets that are there. They have all the machines that you need. They have an MRI machine. They have a CAT scan. They have echoes. They have everything. Let's say it this way. And so that Mousy, that's how that pup was called, who was very fearful. Mousy had to have an operation on her leg, on the femur. They put some iron inside, outside. And what happened then is, of course, lots of stitches in that case. And my vet, Juan, said, well, I'll see you in 12 days. And I came back exactly 7 days later. And I said, I want to show you something. And he saw the pup, and he saw the leg, and he saw the stitches. And he became a little bit angry. Eva, why did you wait so long? Those stitches had to be out already. And I said, today, exactly a week ago, you operated on this pup. You operated on this dog. It's only been 7 days. And that's not possible, and that's not possible. I said, I can't tell you in other words. Last Friday, you operated on this pup. We are Friday again today. That's exactly a week. He says, Eva, that's not possible. I said, yes, it's possible, because I've been using my torch every single day on the wound, or surrounding the wound, as we call it, giving the energy to the healthy cells so they can close up quicker. And he says, it's impossible, Eva. I said, well, you know what? It's really simple for me. Go to your computer, have a look when I was here with Mousy, and then you will be able to see for yourself how long it has been. He did go and see, and he came back looking a little bit red, and he didn't say anything to me anymore. So the same happened today when he says, in 12 days, get the stitches out of Jack's leg. I said, you know what, I'll come back in 7 days and I'll show you how that leg is doing, how those stitches are. Because he knows. I was there with my torch today too. But yeah, this is what I'm using all the time here. I'm not taking any medication, and this is what saved my life. So maybe I should be talking about that. And I have fibromyalgia. I had a motorcycle accident in 1994, so it's been 30 years now. Incredible how time flies. And that accident apparently was the trigger for my fibromyalgia, which I didn't know at that time that I had fibromyalgia. And if you're interested, let me know here in the comments. I'm happy to make another video about all I did to get relief from my fibromyalgia and to have a normal life again. But to make this not too long, fact is the following. After suffering for over 14 years every single day of pain, which is what you have with fibromyalgia, you have pain every single day. You are sensitive. In my case, I was sensitive to light and to sound and to temperatures. And one moment I was okay. The next moment, although you didn't see it from the outside, the next moment I wouldn't be able to move anymore. Hardly had any social life left because you are exhausted. Your body just doesn't want to anymore. After 14 years, I was ready to call it quits. And I was lying in my bed with a broken back. And that's when I found this doctor who makes these and who sells this. And that doctor, Dr. Brian McLaren, he saved my life. After only 5 weeks, more or less, of torching every single day, I was able to let go of all my medication. And I've never had to take any medication anymore. If I'm in pain, I take my torch. If I feel that I'm getting, maybe I got a virus or something, I'll just put the torch here, put it on, of course, put it there for 15 minutes to give that energy into the bloodstream. It's just a safe red light at 660 nanometers, but that's the tool that I use for any physical or mental issue with all my animals. And that has saved me so much money. Yes, Jack is getting heart medication. He has a genetic heart problem. His brother died years ago. He was only 6, I think, or 7 maybe. And as soon as we heard that his brother had a heart problem, I went with Jack to the vet and see the heart specialist. And so we discovered that Jack had the same issue. So yes, Jack is on heart medication. I'm gonna take that away from him. But right now, he's not gonna get any pain medication. I'm using my torch. I know it may be strange for you to understand what it's doing. And I can put a link here in the comments, in the description. I'll put a link so you can learn more about it. But I've used it on any kinds of animals. And let me share a picture here. Here you can see on how many different animals I have been using this. And that's also what I'm doing these days. This is what I love doing. I used to be a lawyer years ago. And on the one hand, I still am a jurist. But most of my time, I'm helping individuals. I'm helping pet owners so that they themselves at home can relieve the pains of their pets. And also, often, people find me when the vet cannot do anything for them anymore. Let's just think of a dog with hip dysplasia. And I've got a video of that. Think of a dog with hip dysplasia. They will give medication. Sometimes an operation is not possible anymore, or the pet is just too old. I've got such pets. I've got such dogs that could hardly get up anymore, that could hardly walk straight anymore. And yes, I'm going to put the video of Jordis in here too. Yeah, let me do that. So here you can see Jordis. You can see how he's having issues to walk straight. He's having issues to get up. And these people, if I remember well, they are in the United States. They bought the torch. They started torching the specific points on the dog for hip dysplasia. And look at him. Look at him. Yes, 14 years old. Look at him running again. And yes, I know. If you're new to this, you will say, I don't really believe this. This is not possible. Well, just Google red light therapy. But do remember that the red light therapy in itself only takes care of the problem where you are putting the light. But what we do is, apart from torching locally, with this torch, we can also torch specific acupuncture points. And that's where the magic is, because with torching acupuncture points, we can deal with any physical problem and emotional mental problem. Pretty soon, I just shared that today on my Facebook page. Pretty soon, you're going to have fireworks again. How many animals are not scared of fireworks? So this is now the time that I am starting to tell people. On the one hand, if you don't want to get the flu this winter, start torching your points. And for the pet owners, fireworks are coming. So start torching the points of fear and anxiety now on your pets. You can do them on your horses. You can do them on your dogs. You can do them on the cats. You can do it on any animal of whom you know who is fearful of those moments. And you will see I have plenty of people who have responded to me and who have sent their experiences of dogs later on sleeping through the fireworks. Yes, sleeping through. Now I know this video has been something completely different than usual. And I'm going to be honest, I didn't really know what to talk about today. because the week has been pretty stressful because there were some deadlines that needed to be met for some volunteer work that I was doing. That all finished last night. And Jack had to have his operation. So I wanted also to spend time with Jack. Because even though an operation can be small, you never know what's going to happen. For the same price, once Jack was under anesthesia, the same price, we could have seen something different. And that has happened with one of my other dogs, well, rescue dogs, a few years back in 2020. He was put under anesthesia and he didn't wake up. Or we had to decide to not wake him up. So if you have a pet, go and give it a hug right now. Go for a little walk. Tell them how much you love them. And remember, we only live once, and they only live once. Well, at least with us right now. So, go and play with your animal. Go and hug it. Go and caress it. Spend some time with it. And you can then repeat that every single day. Because you never know when it's going to be the last day. Have you seen that smile on my face? I'm happy. I'm happy that it was just one tumor. It was quickly done. I still have him with me. He's doing well. He has already been begging for food. And if you do not have a pet, why don't you pick up the phone and give somebody you love a little call and let them know how you feel? I'll see you next week. Bye for now. Take care of yourself.